Now, Rivers State is grappling with a public health emergency as a suspected cholera outbreak has claimed the lives of at least 9 individuals, leaving several others hospitalized. This tragic development has sent shockwaves through communities already facing challenges of limited access to clean water, sanitation, and adequate health care infrastructure. Cholera, a preventable but highly contagious disease, thrives in such conditions, and its resurgence underscores the urgent need for proactive measures to safeguard public health. As the death toll rises, public health experts and government agencies are working tirelessly to contain the spread of the disease and prevent further loss of life. However, questions remain about the state's preparedness for such outbreaks and the effectiveness of interventions. Public awareness, access to healthcare, and also improved hygiene practices are critical to addressing this issue, but achieving these goals require coordinated efforts and sustained investment.
That's right. And so to delve deeper into this situation, we're joined by Dr. Adaeze Oreh. She's a Commissioner for Health at Rivers State. Doctor, many thanks for joining us. Of course, you're going to shed a light on this troubling outbreak and what can be done to prevent further casualties. But let's just start with, the news at first. What was the primary cause of the cholera outbreak in Rivers State, particularly in these communities, and how did it escalate to this level?
Thank you very much. We received the very first reports on the 11th of January. And of course, we immediately activated our Public Health Emergency Operations Center, convened our rapid response teams, and mobilized personnel and sent them to the affected communities. Now, we have 2 affected local government areas, the Andoni local government area and Akokutoro local government area. In Akokutoro, we're able to actually retrieve stool samples, which was tested and actually confirmed. So we recorded 5 fatalities in Akokutoro. And then for Andoni, by the time we received the report from Andoni and sent our teams on the ground, we were unable to get stool samples from the suspected cases. Of course, the reports that reached us were following fatalities. So because the symptoms that were reported, what the information we were able to get on the ground fit perfectly with the case definition of cholera. We're working with suspected cases of cholera as the causes of death. And so, aside from our surveillance investigations, which have been ongoing, we're working with the local government authorities, the Community Development Committee, the traditional structures within the local government areas to sensitize the populace. Now, down to the question about the cause. Now, these are riverine communities, many of which have challenges with water, sanitation, and hygiene facilities. They mostly or largely rely on surface wells. And even though typically across the country we should be in the dry season, rains have started in multiple communities in Rivers State. And so with the rains, there is some washing of contaminated waste material into some of those wells. From our investigations, there are likely to have been some funeral practices and convergence of increase in population in certain parts of the community, challenging those already suboptimal water sources. And so that's what we're working with currently as the cause of the outbreak. Regardless, we have prepositioned some materials to purify water sources while we're working with the local government authorities for more sustainable, safer water sanitation and hygiene facilities within the local government areas. There is a new administration for the local government in place now. Some of this work we had commenced with the previous administration and we're continuing. And so we have some communities that have benefited from improved water sanitation and hygiene facilities. And not just the provision of those facilities, a mindset for sustainability. How does the community run such structures after they have been provided? we all know that there's a power component to it, which can be burdensome financially to some of these struggling communities. And so there's also provision of solar facilities that would power such water sources so that the communities are not overburdened by powering this. And this is where the local government authorities comes in. We are also working with the Ministry of Water Resources, Ministry of Environment. It's not just a health issue. These are some of the social determinants of health that come with ensuring improved health and well-being. And so if we want the work that we're doing now in containing this outbreak to be a lasting, to provide lasting solutions, we have to reach out with our colleagues across relevant line ministries and parastatals to ensure that our communities are safer. There's also the problem, which we can't run away from, of open defecation in some of our communities, especially amongst children. And so while we advocate and state that open defecation is wrong, it's unsafe, and it jeopardizes the health of the community, we also have the burden of responsibility of providing safe alternatives for the communities to use. A lot of children won't understand that they cannot just defecate and relieve themselves wherever they can. And this is where alternatives, safe alternatives, must be provided, and we're working assiduously with the local government authorities and other partners to ensure that we do this for our communities.
Doctor, now, so this local government areas have been affected by this outbreak, that have this outbreak are riverine areas, like you said earlier. And so one has to talk about the accessibility to these towns. Oftentimes, riverine areas, you needed both to get there. So my concern is about primary health care facilities. Are they available there? And what is the primary health care structure like for riverine areas and in entirety of River State?
So thank you for raising that, because River State, we have a beautiful but very diverse terrain. And so for some of our communities that are riverine, they also have primary healthcare facilities within them. And this, of course, as you recognize, will increase the logistic challenges of getting commodities and resources to those facilities, but they are also built in to the primary healthcare structure, because the cost of taking commodities to an upland center is much less than that for the riverine, but it's something that is built into the operations and is not a challenge. So immediately the Ministry of Health received the information from these communities, we immediately sent our teams out, and they were there a few hours after the reports were received. And so this also brings me to the recently revitalized emergency services which we have in the state, and some of which has the marine component, which is how to get emergency cases from riverine communities that are inaccessible by road. Fortunately, both Akukutoro and Andoni are accessible by road, but some of the smaller communities, you need to get to them through the waterways.
Now, Dr. Oreh,
for your question on the primary healthcare structure, it's all built in to how we access our facilities, and there are primary healthcare facilities in those LGAs.
Would like to thank you for giving us a structure about these healthcare facilities, also giving us you give us a very interesting take on how this whole thing started. However, now that it's begun, now that it's been identified, what measures are in place to actually curtail it, to contain the outbreak in those places so it doesn't affect other communities?
So we've identified the water sources, we've identified the primary cause of the infection, and we're carrying out massive sensitization, working with the community structures to educate the communities with pre-positioned items, commodities, oral rehydration salts, intravenous solutions, essential medicines in all the primary healthcare centers and the general and cottage hospitals that are around those communities in those vicinities. At the same time, we've engaged more hands to be at the primary healthcare centers and the communities, serving as volunteers to interface with the people of the communities. Fortunately, since then, we have not had any more case reports. So there's no escalation at this time of cases from the infection.
Okay.
However, our teams are on ground. We're sensitizing the entire state and putting the neighboring LGAs on alert that this is what is happening, sensitizing our staff in the neighboring LGAs so that they are aware and they're on hand to immediately manage any cases, further cases that come up, and we contain this outbreak. So for now, the status is the same as on Thursday when I gave the first press briefing and release of this information to the public.
So does this outbreak point to any implication on the part of the government regarding governance of the state, where you have situations where these diseases that can be contained or curtailed or even prevented totally are happening inside of these communities? Do you think there's a gap in governance in Rivers State that might, well, implicate governance?
I would say that this actually highlights the governance of this, the importance of governance and the community orientation of the governance of this present administration. We've seen massive attention to community health, and I believe that it is the resilience and the responsiveness of the communities that enabled us get the information within hours of the demise of the individuals. Now, governance is a work in progress, and we cannot rest on our oars and say, oh, fantastic, we have a community orientation, the information channels are seamless, and we'll rest on our oars. No, we need to do even more to protect our communities. And so I would say this highlights the governance, community-oriented governance of the administration of Governor Fubara, and the fact that health is one of the major priorities of his administration.
Right.
This has enabled us respond quite proactively and really quickly to the reports that we received. And so we're looking to building sustainable water, sanitation, and hygiene facilities across communities in the state that will further add to the robustness of our health system.
I have to ask, as we're talking about, community-centered governance, where proactiveness, we have to talk about the future and put this in, in focus. Riverine areas are prone to cholera outbreaks, especially when it comes to open defecation issues and also their source of drinking water, And so I have to talk about a synergy here. My question is there a synergy between, say, for example, or an agency that is in charge of sanitation and waterways with the public, with the commission, or rather the Ministry of Health, where you oversee for the future, for the sake of the indigents and the residents of riverine areas, for the future, so we don't have issues like this. Because the rainy season, they're fast approaching, and we know the water levels are rising. There's also climate change. And the impact of accessibility to clean drinking water are all variables that will continually increase the cholera outbreak.
Yes, thank you very much for raising that question, which allows me to share some of the structures that we have in place. Within our Public Health Emergency Operations Center, the Ministry of Water Resources is a member of that EOC. And so when we receive such reports, they too are privy to the report, and we work hand in hand. Every decision that's taken at the Public Health Emergency Operations Center level carries them along. They are members of that committee. And so they are able to give us information from their own perspective, which is Ministry of Water Resources, while we bring in the health system. We have to work in this kind of synergy if we anticipate that we actually want to solve this problem sustainably. Additionally, we also have the Primary Healthcare Task Force, which is chaired by Her Excellency the Deputy Governor, Professor Odu. We meet quarterly, but the membership of the task force spans, is not just for the Ministry of Health or the Primary Healthcare Management Board, but we have the local government authorities, we have Ministry of Education, Ministry of Women Affairs, we have international partners, water resources, civil society, and the security agencies as well, just as a summary. So it is these cross-cutting measures, these synergistic collaborations that will enable us effectively work in our communities. We cannot just come in as a health ministry and plan to carry out successful work if we're working in silos or if we're working in isolation.
And what about the public awareness campaigns that you spoke about from earlier? What structure do they take and how far-reaching can they be, noting that these are riverine areas, hard to get to, so that people are educated regarding the risks of open defecation and the likes that could cause cholera?
So we work together with the community structures. So we use local people who are on the ground. They join us as volunteers using the traditional means of disseminating information and also escalating that to work with, say, radio media that is quite common in use across the state. So we use community information delivery mechanisms aside from the more common radio announcements that would sensitize or raise awareness for people in River State across the state. When we seek to raise awareness and sensitize communities, we can only do that successfully if we're working with their respected community structures. Because, you know, in infectious disease outbreaks such as these, there could be the issue of distrust, and we want to leverage already trusted means within the community, providing the information that they need, providing the visible support that will help engender that trust and help their volunteers communicate this actively with our support to the people of the communities.
I mean, Doctor, I must say thank you for just taking out the time to join us for this discussion and just giving us a bit of insight into how, you know, the state government and your ministry is managing this outbreak and you know, what's in plan for the future. Now, we hope that it's one thing to plan, it's another to implement, and is another to follow through. I just do hope that the implementation will be solid and would see results in the near future. But thank you for taking out the time this morning to join us and for your insight. We appreciate you.